Hello, my name's Dr. Cameron Jones and I'm an environmental microbiologist. Like many of you, I've also been watching what's been happening with the emergence of this new infectious disease that we now know as coronavirus or COVID-19. Now, it started in January, we're now into March, and we all know that it started in China, but it's now affecting other countries like Italy, Iran, and more recently, Australia. Definitely looks like we're heading towards a pandemic. What is a pandemic? How does this differ from an epidemic? What is your workplace doing? How can you contribute? Viral infections are scary, mainly because they're a little bit different to the more common bacterial and fungal infections. I'm here to introduce you to a new short course that's going to explain some of the foundational principles of coronavirus. You can easily then incorporate this information and use this in your workplace and when talking about this with friends and family, and goes beyond what you can easily find and source from the internet yourself. For example, many of you are probably looking on with some humour about the rush on toilet paper and some common food items here in Australia. But what underpins this herd mentality? Obviously, people are frightened and scared, and it's my job and the job of the educators here to provide you with some common sense and scientifically valid and credible information. For example, a paper came out just a couple of days ago on March 4, which was looking into some of the COVID-19 infections in the infectious disease hospital ward in Singapore. They discovered and published in this paper some of the more common transmission routes for COVID-19. And do you know what they found? They discovered that something called fecal shedding and environmental contamination was a very important way in which this virus appears to be communicated to other people. Therefore, what is fecal shedding? How does this differ from droplet spread? For example, when someone coughs or sneezes. This course is going to go into great detail about all of this and bring a lot of the information out of the journals and discuss this in common terminology to make it understandable. One of the points of this course is to explain some of the uncommon terminologies and vocabulary that is being used and published in the news media to discuss this. And it's going to then move towards how you can practically protect yourself, how you can protect your family, and even introduce new work practices into your workplace. Getting back to that most recent publication, the scientists showed that the chairs, bed rails, door handles, even window glass all contributed to causing transmission of COVID-19, and these virus materials were recoverable from these surfaces. And this publication emphasizes the importance of environmental cleaning. That's something which is not being discussed widely in the news media. And so we're going to be delving into a lot of this important information so all of us can take control of our own health and improve everything. For your interest, I just got off the phone with a client who is considering how best they can decontaminate their industrial work premises. Now, if COVID-19 infections do go nationwide, people are going to want to know the difference between a disinfectant, a sporicidal disinfectant, a sterilant, and a sanitizer. And you should learn this information now. In summary, if you want an easy to digest public health overview, then this course will extend past what you can find easily online and will help you make sense of this situation. Certainly in March 2020 and extending towards the rest of the year. In any case, my name's Dr. Cameron Jones. I'm an environmental microbiologist and I hope you enjoy this course. Bye for now.